I'm Laura Thomas, and I'm a physical therapist with Sports Plus Rehab Centers. Today I'm going to be talking about exercising during pregnancy. So during the talk today, we're going to talk about the benefits of exercising, some general tips for exercising, also some added pregnancy guidelines, and how to make your exercise more enjoyable, as well as we'll go through some specific exercises and the contact information that you'll need to get from me. So what are the benefits? First, in 1993, the Physical Education Journal of Sports Medicine stated in a summary article of all the literature that you can exercise safely with minimal risk to yourself and the baby. You may not, however, be able to exercise at those pre-pregnancy levels that you were exercising at before. You do derive benefits from being active, and it helps control things like hyperinsulinemia, otherwise known as diabetes, weight gain, and your mood changes due to hormones. You should, as always, consult a physician before beginning that strenuous exercise program. So in general, exercising regularly is most important. However, whenever you are pregnant, you should avoid heat, and that comes in forms of hot and humid weather, as well as if you're running a fever. Keep in mind that your connective tissues are lax, so you can damage those joints, especially in your hips and your knees, as well as in your back. So you should avoid ballistic type movements such as jumping, bouncing, or sprinting type running activities, as well as jerky movements. And then also keep in mind to avoid full flexion and extension of your joints and stretching to a maximum. As with all other exercises, you should warm up and cool down. It's recommended 5 minutes for each. With your heart rate, you want to measure during the peak activity. So when you're at your most strenuous part of the exercise, and you shouldn't exceed maximums. Most importantly, hydrate, hydrate, hydrate. So if you're not drinking water, you're affecting the amniotic fluid, which your baby is in at this point in time, and that can become decreased, which can lead to complications. Again, begin with the basics. So if you haven't been exercising, start out simple. And again, finally, consult your doctor. So what are those added tips for pregnancy that you have to keep in mind? Your maximum heart rate. If you're on land doing things like a cardiovascular program or a strength program, keep your heart rate at a maximum to 140 beats per minute. If you are doing the program in the water, that limit decreases to 125 beats a minute. You should limit strenuous activity to a high of 15 minutes. And then, of course, after the 4th month, you shouldn't be lying on your back. Avoid all exercises where you hold your breath, like sit-ups, crunches, or anything else where you might hold your breath. And ensure that good caloric intake. So you are supporting you're supporting you and the baby now, as well as exercising. So you need to make sure you get proper nutrition. And finally, as with the heat that we talked about earlier, keep your core temperature below 38 degrees Celsius. These tips were published originally in 1985, and since then, new information about the responses of pregnant women and her baby to exercise have become available. Women who began pregnancy already fit and participating in vigorous activity stated that the original guidelines were too conservative, so they found new findings, and these are what they came up with. These women that were already active had improved tolerance to heat and cold in the external environment. Their babies had increased fetal movement, which showed that they were more active and healthy, and those babies were born with normal birth weights and sizes. So how, when we're pregnant, can we make exercise more enjoyable? So you should be comfortable during exercise. You should rest when you're tired and don't strain. You should perform the repetitions of exercises a little more slowly and steadily, and concentrate on every movement and feel your body as it performs it. And again, don't do pumping, jerky movements. Unless you're accustomed to vigorous exercise, start your program just using 5 exercises. You don't need to go to extremes. Spend 1 minute on each exercise and then progress from there. You want to make sure that you're breathing deeply and rhythmically and continue throughout the exercise breathing. You don't want to hold your breath, and this will help increase the relaxation that you have from the exercises, but you don't want to hyperventilate either. Make sure you're beginning and ending each exercise with the cleansing breath, which we'll go through later, to practice this because you're going to use it during your labor and delivery. You can add music if you like it. If not, you don't have to. Like we talked about earlier, you want to avoid overstretching those ligaments. And another important thing is to avoid the toe pointing, which can cause your legs to cramp more. Make sure if you are practicing in a pool that you have some form of watch or clock that has a second hand so that you can time these exercises. And then be creative. Combine the exercises and make it fun and enjoyable for you and to fit your needs. So these are some exercises and we're going to go through them. These are all beginner exercises, and if you would like to discuss a more advanced and/or specialized program based on your individual needs, we have a list of therapists at the end of the talk that you can contact for that information. These two exercises are going to be really important. First is the Kegel, otherwise known as the pelvic floor contraction, and that is important for maintaining incontinence during pregnancy and then also after the delivery. What you do is you think about stopping the flow of urine, and that is usually what gets the best contraction, and the easiest way to get the contraction is in this lying down position. The next exercise is the pelvic tilt. This is important for maintaining decreased amounts of back pain during pregnancy. For the first 4 months, you can do this in lying down. What you're going to do is you're just going to gently push your back flat to the floor, couch, bed, or wherever you're laying down. After those 4 months of pregnancy, you're not going to be lying on your back, so you're going to stand up. So you can stand up against a wall right there and push your back flat into the wall. Like I said, we were going to go through the breathing techniques. The first one we talked about was the cleansing breath. You want to do these. These are in terms of actually going through labor and delivery, but you need to practice them before you go through that so you know what you're doing. First is the cleansing breath. So you're going to do these twice at the beginning and end of each contraction. You inhale slowly and deeply through your nose and then exhale slowly and completely through your mouth. In the early stages of labor and delivery, you have a different breathing pattern. You're going to use slow chest breathing, so you're going to take a large deep breath, expanding your chest fully, and that is usually at a rate of 6 to 9 breaths per minute, and you'll do that for 1 minute. As you start going through pregnancy, you'll go to the transition breathing, where you're going to combine that short, panting, shallow breaths with your deep, full exhalation, otherwise known as the blow. You're going to do 4 to 6 pants and then a blow, and you do this for 1.5 minutes. Finally, when you're actually having the child, you use a different breathing pattern again, and it's a sequence of 2 cleansing breaths, which we talked about over here, followed by a deep inhalation through your nose, and you're going to hold that for 5 to 10 seconds, and then finally exhale deeply through your mouth, and you'll repeat that for 1.5 minutes. So it's good to practice these before you actually go through the delivery process. So, if you do not have access to a pool, here are some land-based exercises that you can do. First one is hip abduction, so you're kicking your leg from here out to the side. This helps strengthen up your hip girdle and keep it more stable as your joints get lax. This one is hip extension, so you're kicking backwards like a ballerina. And this again helps keep your hip girdle stable. The next 2 are stretches in preparation for delivery. This one is a gluteal stretch. As you can see, she's laying down and it's stretching this back part here. If you can flatten this leg out, but as you go through your pregnancy, it may be difficult to lay down, which is especially important after the 4th month, so you can do this when you're sitting in a chair. This is the piriformis stretch, and the piriformis stretch is a small muscle that goes across your sciatic nerve, which can send pains down your legs, so we need to make sure this muscle stays loose and does not get tight. You cross one leg over the other and then gently lean forward. You should feel this deep inside your booty if you're doing it correctly. Make sure you're getting both legs for all of these. Finally, there is a pelvic floor stretch called Happy Baby. It's actually a yoga pose if you're familiar with it. It is good to use in preparation for delivery to avoid excessive damage to those pelvic floor muscles. As you can see, she's lying on her back, so keep this in mind with lying on your back restrictions. Her knees are coming towards the floor and her hands are on the inside of her feet. You should always maintain cardiovascular health. So ideas while you're pregnant are walking and jogging, but only if you were previously active. Machines that can be of benefit are the treadmill, bike, elliptical stepper, or anything else you can come up with. And if you are involved in a group program, especially the non-contacts, don't go play, a pickup game of basketball. But you should avoid those ballistic movements we talked about earlier. If you do have access to a pool, these are some very good exercises that will help loosen up your hips, hip muscles, but also promote strength as well. So this first one is a bicycle kick. She's hanging on the side of the pool. You can also do this sitting on the steps into the pool, but you just pedal your feet like a bicycle. This one is called a hip touch. So you're going to be standing next to the edge of the pool and you're going to be standing up straight with one arm on the side. You're going to keep your shoulders above the water and your feet planted while you bring your hip to the edge of the pool. Make sure you do turn around and do this with your other hip as well. Just like on land, you can do leg kicks. So there's forward and backward, and then you also have in and out away from your opposite leg. Finally, you have a back extension stretch. So if you're earlier on in the pregnancy where your belly isn't quite as large, this will be a little bit easier to do it this way, where you bring your feet up the wall and hold on. You should feel a gentle pull along in here. Now later on in the pregnancy, you may not be able to do that. So this is another way to achieve that stretch. Another enjoyable exercise if you're in the water is called the deep water hang. So you put a noodle underneath your arms. Some people prefer two, so one goes around the back. If you have two, make sure you put the back one underneath the front one, otherwise you'll flip. And just hang in the deep water. It helps relax everything, and the water helps support your baby and that expanding belly, and it takes some of the pressure off your back. Ideas for cardiovascular health in the water. In the shallow water, you can do walking or jogging. In the deep water, you can do a jog, or bring both your knees up to your chest and then back down. And again, you'd use the noodles to help you with that. There are machines, and some of our centers do have these machines in the pool, but they include a treadmill, a bike, a skier, and they have other equipment. Or you can be involved in a group program, but again, you're going to avoid the ballistic activities. So if you have any questions, we have 4 clinics in the West Tennessee area that have women's health therapists on staff. So the first 2 are Sports Plus Central, which is located by the hospital, and Sports Plus Aqua Therapies, which is also in Jackson, and they each have 2 therapists. However, these 2 clinics will be combining their staff in January of 2013, and they will be located downtown at the new lift facility. At that point in time, if you have any questions, please contact Brian Thorne, who's going to be the clinic manager, and he will redirect you to the appropriate staff member. It'll be these 4 people. The other 2 clinics that have women's health therapists on staff are Sports Plus Milan. They do not have a pool there, and Sports Plus Dyersburg. There is a pool there. And then we have other clinics located throughout the West Tennessee area. This is their contact information if you live in those areas. And we all work together as a team, so if they ever have questions about what can and cannot be done with a pregnant woman as a patient, they do contact us. Some of these clinics do have pools, others don't. If you have any further questions, feel free to contact me. My information is right here, and I will be happy to answer any emails that you have.